It has been trending on the internet this weekend that there are changes in plastic surgery trends toward smaller. So, smaller implants for things like Brazilian lifts and other areas, and smaller grafts, smaller fillers, that sort of thing. So, I thought this would be a good opportunity to discuss cosmetics with regenerative medicine, stem cells, and exosomes, and what can and can't be accomplished. And interestingly, the trend toward smaller and less severe plastic surgery kind of meets halfway in the middle with using exosomes and stem cells to achieve goals, which are also modalities that result in a more natural appearance. I think, in a general way, and I'm not a plastic surgeon, that stem cells and exosomes and your own fat are maybe a little safer cosmetically than using artificial substances. There are fillers that absorb, and there's lots of filler work done, and it's done very well. But I think there's a trend toward more natural, which again dovetails with cosmetics. So some of this gets into a regulatory morass that gets kind of complicated, but let me kind of lay this out. Stem cells and exosomes can be used topically for cosmetic purposes in the United States, but not to treat disease. So topically means that you can apply it topically, and you can do a microneedling. So you get a little punctate needle that opens your pores and makes you bleed maybe a little. And you can do this, and then you can put on exosomes and stem cells that allows them to get into the skin, into the bloodstream a little bit. What you cannot do in the United States is inject with a needle under the skin or into the scalp. So we do some cosmetic work at our institute in Antigua, and I'll just kind of tell you what I think are the most useful things. So one thing that we do there is inject stem cells into the tissue just under the skin in the scalp for hair thickening. We then give stem cells intravenously. The intravenous stem cells are drawn to the inflamed area. So you get stem cells that work directly from injection, and you get stem cells that are drawn from the intravenous injection to the area. And this results in hair thickening in males and females. So if you're completely bald, it won't work. And it works most of the time in males and females for thinning. It doesn't always work, and we're not exactly sure why. There's really no downside to doing it, and as part of our ongoing research studies, we're trying to identify when it works better and when it doesn't. There are some circumstances. We had one particularly remarkable case of a young woman who had polycystic ovary syndrome, and we injected her scalp and her hair got thicker, but the intravenous cells amazingly seemed to result in the polycystic ovary syndrome going away completely, with normalization of her menstrual periods and hormones and cysts. So the combination of those two things resulted in her hair becoming of normal thickness, and she's almost 2 years after treatment and has done well. That's not the usual case. Usually it's just natural thinning of hair, male pattern baldness, so-called, but this occurs in females as well. Now, what you could do in the United States is do microneedling and massage in exosomes and stem cells. And this might work well. I don't know of any research reports on it. They may exist. We've been a little afraid to do it because we're a little afraid of traumatizing hair with the microneedling device. But this might be an approach that's successful and could be done in the United States. So regarding hair, we are doing what I described in Antigua and overall having good results, although not in every case. Regarding skin, we do microneedling on the face and on the neck, and it can be done hands, it can be done elsewhere, and then massage in stem cells. And we get generally very good results, better in some than others, again, for reasons that we haven't entirely explained yet. As we do more research, I think we'll figure this out. The other thing that one could do is inject into wrinkles under the skin with a needle where it's licensed, as we are in Antigua. This you cannot do legally in the United States. We haven't done it because we're a little afraid that the stem cells might work too well and cause uneven thickening of the skin. This hasn't occurred, and I don't think it will occur with microneedling. Now, in the United States, as I said, you can do microneedling. So it's legal to do microneedling of the skin and the scalp and to massage in exosomes or stem cells. Exosomes are relatively easy to take care of. They need to be refrigerated or frozen. Stem cells are harder to take care of. You need a special liquid nitrogen freezer. They have to be specially shipped. And unless you're a stem cell center, such as we operate, if you're at a cosmetic facility in the States, it's just probably kind of hard. These are living things. It's just very tricky to use them safely. But exosomes can and are being used in the United States for topical purposes, and the work with them is expanding. And the exosomes work pretty well. In fact, and people use platelet-rich plasma, where blood is drawn and growth factors are isolated and injected. So platelet-rich plasma, exosomes, and stem cells can all be used for sort of similar purposes. And they all have good short-term results. So what's the difference? Well, hard to know. PRP, platelet-rich plasma, seems to work, but it doesn't seem to work very long. Stem cells work much longer. Exosomes, we don't know. Maybe intermediate, maybe not. But the clear growth area in the United States is exosomes being used legally with FDA approval for cosmetic purposes, topically, either just right on the skin or through microneedling to get into the skin. So it's a little more complicated than this, though, because all exosomes are not the same. The exosomes that we use, it's actually called a secretome from Vitro Biopharma in Golden, Colorado, has roughly 100 billion exosomes per cc. So there are some companies that say they have 5 billion or 1 billion or 500 billion. It's really hard to know. And to make things even more complicated, when Vitro Biopharma has assayed exosome products from elsewhere, they have found that often what they're kind of marketed as being doesn't exactly correlate with what's in them. So, this gets to be a complicated area. But if you're using exosomes from a reputable place with a good number of exosomes, using them topically with microneedling, I think is quite worthwhile. We're doing studies. They're being done in the United States. There have been biopsy studies showing that these exosomes and stem cells actually make the cells in the skin, the fibrocytes that make collagen and such, make them work better. So your body is actually replenishing its own tissue. So we're early on in the space. We're going to be knowing more. We already know that it works pretty well. And I think over time, as we get this figured out, it's going to work even better. And at the same time, it may be the case that we will be allowed to inject under the skin. We'll see how that goes. But in the short run, I think these are useful. And they, again, also kind of dovetail with what we're reading about plastic surgeons. And they have said that the use of semaglutide and people losing large amounts of weight leave skin that's kind of flattened and maybe wants to be filled in with fat or with substances like this. So the other thing is that fat can be combined with stem cells. It's not legal in the United States, but I think it's going to be, but it's done overseas. So I think that regenerative medicine, especially with exosomes and with stem cells too, is already doing good work. I think it's going to get better. I think it dovetails well. Plastic surgeons can use these things together, and it combines better with the more natural look that we've been reading plastic surgeons are doing. So I think going forward, this is all good news. I think it's a more natural look, less artificial substances. As to what you want to look like, that's a matter of aesthetics. But I think more natural in general, I think people generally think is a good thing. And I think regenerative medicine for cosmetics is helping us get there.